Hi, and welcome to the VieSID Press-release. In this video, we report on articles selected from the dental literature published in January 2024. We hope might be of interest to the VieSID community. So let's begin. In the Archives of Oral Biology, Rosero Salazar et al. Reported on an experimental study exploring muscle activity and respiration during chewing and swallowing in mini pigs. Previous studies had shown that the mini pigs were a suitable model for representing chewing activity in humans, as in other large mammals. The authors analyzed real-time muscle activity during oropharyngeal functions, including chewing, swallowing, and respiration. Muscle activity was monitored using needle electromyography. Electromyographic and respiratory signals were acquired simultaneously. 6 pigs were monitored while feeding on pig jaw mixed with barium sulfate suspension. The barium made the food and the bolus visible while the feeding course was videotaped by radio-video fluoroscopy. Needles were inserted in the following muscles: the pharyngeal and hyoid muscles, such as the middle pharyngeal constrictor and the thyrohyoid. The palatal muscles, including the tensor veli palatini and the levator veli palatini, the tongue muscles, the genioglossus and styloglossus, and the jaw muscles, the masseter and the gastric. This image shows the raw tracing of electromyography and respiratory airflow. The dotted lines indicate the inspiratory I and expiratory phases, indicated with an E, in relation to the chewing cycles and swallowing event. The activity of the middle pharyngeal constrictors, styloglossus, and masseters were shown. Let me remind you here that these results were observed in these graphs were produced with a mini pig model, not human. The mini pig chewing activity featured side alternations with larger masseter activity along the working side, as expected. Activity burst of masseter and styloglossus occurred in jaw closing and burst of the digastric in jaw opening. The duration of the jaw opening phase was shorter than the closing phase, including the power stroke. So 42% of the time to 58% of the time, respectively. Electromyography recording in chewing and swallowing is shown in this image. Burst activities are indicated with arrows on each muscle recording. For chewing, the activity burst of the digastric was used as a reference for jaw opening phase. The activity burst of the masseter and styloglossus indicated the jaw closing and the power stroke phases of chewing. For swallowing, the activity burst of the middle pharyngeal constrictor was the surrogate for the duration of swallowing episode, indicated by the vertical lines. The tensor veli palatini and the levator veli palatini activity bursts appeared almost simultaneously with the middle pharyngeal constrictor, indicating these two palatal muscles activated during swallowing episodes. The swallowing episodes occurred during jaw closing, demonstrating by the masseter and the styloglossal activity, followed by the digastric and genioglossus activity in jaw opening. The swallowing episodes often occur sporadically, neither consecutive nor stereotyped as seen in the chewing cycles. The post-swallowing jaw opening phases were most likely for enhancing inspiration after the short breathing interruption during swallowing. Respiration is shown here. Chewing and swallowing are in general voluntary actions coordinated with spontaneous respiration. The present study revealed that more than 80% of the chewing and swallowing episodes occur in expiratory phase during swallowing. An interruption of the respiration was seen regardless of the respiratory phase, lasting approximately 1 second. the conclusions. The masseter muscle showed a strong activity during the occlusal phase, the power stroke of jaw closing. The digastric and glossal muscles were highly active in jaw opening, and the styloglossus showed two-phase activity in both jaw opening and closing. The palatal and pharyngeal muscles are active not only in the swallowing process, but also in chewing, showing highly synchronized activities. The coordination in respiration showed sequential increase of the air flow velocity and sequential decrease of the pressure in jaw opening and closing phases and swallowing. The largest amplitude in chewing occurred in the pharyngeal, palatal, and jaw muscles, while in swallowing it was observed in the tongue, palatal, and pharyngeal muscles. The two-phase activity of the palatal and hyoid muscles is a new aspect to consider in the functional analysis of pharyngeal muscles, especially in the study of dysphagia or swallowing disorders. Dental Clinics of North America published a special issue on controversial topics in dentistry and oral and maxillofacial surgery, curated by Dr. Harry Dean, the chair of dentistry and oral maxillofacial surgery at the Brooklyn Hospital Center. Several topics were discussed in this issue, including sleep apnea, anticoagulant medications, short implants, CBCT imaging, osteonecrosis medications, anesthesia, and antibiotic prophylaxis, among the others. I want to bring to your attention a special issue of the Journal of Oral Rehabilitation on Braxis, edited by Lobeso, Manfredini, and Alberg. The topics and types of article included were varied. This issue also reported on a proposed new tool for assessment of bruxism named STAB, which is good to look into for the sake of information. In quantitative imaging in medicine and surgery, Lee et al. Published a paper testing the validity of ultrasonography as an alternative to MRI for TMJ anterior disc displacement. In fact, ultrasonography has been applied as an alternative method to TMJ, to the of MRI in the assessment of TMJ pathologies, as it is easily accessible, not invasive, low costs, and dynamic imaging technique without radiation. The present figure shows that the L-shaped ultrasound probe was placed anterior to the tragus and oriented longitudinally. In quantitative imaging in medicine and surgery, Lee et al. Published a paper testing the validity of ultrasonography as an alternative to MRI for TMJ anterior disc displacement. In fact, ultrasonography has been already applied as an alternative to MRI to assess TMJ pathology, as it is an easily accessible, non-invasive, low-cost, and dynamic imaging technique without radiation. The presented figure shows that the L-shaped ultrasound probe was placed anterior to the tragus and oriented longitudinally. The authors considered 48 patients and eventually included 75 joints, of which 50 presented anterior disc displacement diagnosed through MRI and the DCTMD. 25 joints presented normal disc position. 21 joints instead were excluded because presenting other conditions than anterior disc displacement. The image to the left shows an ultrasound image of a normal TMJ in the closed mouth. Number 1 denotes the condyle. Number 2, the articular disc, which was visualized as a thin homogeneous band. The dotted line highlights the joint capsule. The picture to the right shows the measurements collected for this study corresponding to the lateral joint space, LJS, upper lateral joint space, ULJS, and lower lateral joint space, double LJS. Of those TMJ with a normal disc condyle relationship, 1 over 25, meaning 4%, were classified as false positive, reflective a high specificity, whereas 18% so 9 out of 50 of the anterior displacement patients resulted as false negative, corresponding to a sensitivity of 82%. As a limitation, because of its design, this study didn't test sensitivity and specificity of ultrasonography in other types of displacement other than anterior displacement. So the authors concluded that these outcomes were encouraging and proposed that ultrasound should be considered for diagnosis of this displacement in case of MRI is not available. However, it is still to be ascertained whether ultrasonography can be useful in diagnosis other types of TMJ conditions. We have come to the end of this presentation. I invite you to contact us in case you want to know more about our activities. Otherwise, be ready for next press release. Best wishes to all.